So, you were diagnosed with Lyme disease. You did the weeks of antibiotics, your follow up test came back negative, and your doctor told you you're cured. But there's just one big problem. You are still sick. If that story sounds even a little bit familiar, I promise you, you are not alone. In this explainer, we're going to dive deep into this confusing and honestly frustrating condition. We're going to break down the real science behind post treatment Lyme disease and take a look at a completely different way of thinking about getting better. Here's a quick look at what we're going to cover. First, we'll tackle that frustrating paradox so many patients live with every day. Then, we'll get into the actual science of what's going on inside your body. After that, we'll introduce a new idea for rebooting your immune system, see how it actually works in practice, and then wrap things up by giving you the info you need to take that next step. All right, let's start right there with that central paradox. You've done everything you were told to do. The tests say the infection is gone, but your body is screaming a totally different story. And it's in this gap, this disconnect, that the real journey of frustration begins for so many people. Sound familiar? This quote comes directly from a patient's experience, and it just perfectly captures that moment of dismissal that so many people have felt. It's that moment where your very real, very physical symptoms get brushed aside and slapped with a new label, often without ever getting to the root of why you still feel so sick. And let's be clear, this is not all in your head. These are real, physical, and sometimes debilitating symptoms. Take the story of Jennifer from our source material. She was a marathon runner. After her Lyme treatment, she was left with what she described as a completely broken body. She had this crushing fatigue where even 12 hours of sleep did nothing. The brain fog got so bad she actually had to take medical leave from her job. This is the reality. So why? Why does this happen? If the bacteria are actually gone, why are the symptoms still there? Well, the answer isn't about the infection anymore. It's about the aftermath. It's about a hidden war that's still raging inside your body long after the first battle was won. The medical community actually has a name for this. It's called post-treatment Lyme disease syndrome, or PTLDS for short. And this isn't some fringe diagnosis. It's a recognized condition that affects an estimated 10 to 20% of everyone treated for Lyme disease. The most important thing to take away here is that what you're experiencing is real, it's valid, and it has a name. This slide just gets right to the heart of the conflict, doesn't it? On the left, you've got what your doctor sees, the objective data, the negative tests, the finished antibiotic course. But on the right, that's your reality. It's an immune system that never got the memo that the war is over. It's still fighting, but it's fighting a phantom enemy, and your body is the battlefield. So what does it actually mean when we say your immune system is stuck on? Well, this table breaks it down. The initial Lyme infection basically rewired your immune system's software. Your inflammation triggers are now hyperactivated. Those little inflammation messengers, called cytokines, are just being pumped out nonstop. And look at this. The immune cells in your brain, the microglia, they're also stuck in attack mode. That's where the neuroinflammation and that horrible brain fog come from. It's a system-wide problem that antibiotics just can't touch. So if the problem is an immune system that's gone haywire, then the answer probably isn't just more antibiotics. The answer, according to our source, is to figure out how to reboot the whole system, to send it a signal to finally stand down. And that brings us to a whole new approach. This approach is centered around a medication called low-dose naltrexone, or LDN. Now, naltrexone itself isn't a new drug, but using it in these teeny tiny low doses is. It's not an antibiotic, it's not a painkiller like you'd think. It's what's called an immune modulator. Its one and only job is to help calm down and regulate that out-of-control immune response. So how on earth does it work? Well, the source uses this fantastic two-step analogy that makes it super easy to understand. First, LDN works to shut off the body's blaring fire alarm. That's the chronic inflammation. And second, it actually helps your body produce more of its own natural painkillers and immune regulators. Let's look a little closer at step one. Think of your immune cells as having these tiny little alarm sensors on them. In PTLDS, those sensors, called TLR4 receptors, are basically stuck in the on position. They're just constantly screaming danger, which fuels all that inflammation. What LDN does is it comes in and gently blocks those specific receptors, and that finally gives the immune system the signal to quiet down. Now, the second part is just fascinating. When you take LDN at night, it briefly blocks a different set of receptors, your opioid receptors. Your body senses this temporary blockade and thinks, whoa, we need more of our own feel-good chemicals in here. So it kicks up the production of endorphins. And get this, endorphins don't just make you feel good, they are also powerful regulators of your entire immune system.
Okay, so that's the science. But what does this actually mean for you as a patient? What can you really expect? Let's get practical and talk about what the path to feeling better might actually look like. Now, this is a really important slide because it's all about managing expectations. This is not a magic bullet. Improvement is gradual. As you can see, different symptoms tend to get better on different schedules. For a lot of people, sleep is the first thing to improve. Then the pain starts to decrease. And after that, that deep fatigue and brain fog can slowly begin to lift. It just takes time to reset a system that's been on red alert for so long.
And now for something that might really surprise you, especially if you've been on that expensive medical merry-go-round for a while, the cost. Because naltrexone is an old, generic drug, this low-dose version has to be specially made by what's called a compounding pharmacy, and the typical out-of-pocket cost is right around $40 a month. So you might be asking yourself, okay, if this stuff is so promising, why have I never heard of it? Why isn't my doctor prescribing it? Well, this quote really gets to the heart of the matter. It's about simple economics. There's just not much financial incentive for a company to spend millions and millions on huge clinical trials for a generic drug that they can't patent and sell for a massive profit. Okay, so with all this information, the goal here is to help you move from a place of confusion and frustration to a place of empowerment. So let's talk about safety and how you can use what you've learned to start a completely new kind of conversation about your health. Of course, the number one question about any treatment has to be, is it safe? So let's take a look at what the source material has to say about the side effects and the overall safety profile. Well, the most commonly reported side effects are, for the most part, pretty mild. Things like having really vivid dreams or maybe a little trouble sleeping at first are the most common. But the key thing to remember here is that these effects are almost always temporary. They usually go away within the first couple of weeks as your body gets used to the medication. And when you put it side by side with the standard medications that are often prescribed for PTLDS symptoms, well, the difference is pretty stark. You see, these other drugs can come with significant issues like sedation, weight gain, more cognitive fog, or emotional blunting. By comparison, LDN's side effect profile is described as being remarkably minimal. Okay, this is really, really important. There are very clear situations where LDN should absolutely not be used. This is critical. Because it blocks opioid receptors, if you are taking any opioid pain medication, you cannot take LDN. The same goes for anyone with an opioid dependency or severe liver disease. It is essential to be 100% honest with your doctor about every single medication and supplement you are taking. And that brings us right here to our final thought. For years, maybe your search for answers has felt like an endless cycle of more tests, more specialists, and more dead ends. But what if the next step, the most powerful step you could take, isn't about finding a new test at all? What if it's about starting a new, more informed conversation with your doctor, armed with a much deeper understanding of what might actually be going on inside your body? Now that is a powerful shift.